I'm Mafalda Oliveira. I'm a medical oncologist at the Barcelona University Hospital here in Barcelona, and I'm also the president-elected of the SOLTI-Breast Cancer Research Group. I think that one of the biggest challenges is to accurately estimate the given value of a drug. And this means not only the just price of the drug, but also the magnitude of benefit that it takes to the patients. And I think that we need to put all the stakeholders together to look at these issues about price, try to figure out new models of establishing price for the drugs, with adequate tools in order to see which is the exact magnitude of benefit that the drugs are bringing to our patients. Because if this equilibrium is not met, it's very difficult to bring new drugs to the healthcare systems as we know them right now. I think that the voice of the patient is one of the key aspects also in this thinking about the value of the drugs, not only the price, the magnitude of the benefits. So patients should be brought into this discussion, because ultimately we do all the research and the innovation because of patients to advance their health. And I think they should have a voice, but they should also be educated as all of the stakeholders. And I think initiatives like this will also serve in order to hear the patient, educate the patient, and together with the patient, all of us, of course. Yes, I think the approval procedures are very long. This has to do with some particularities of each country, but it also has to do with this issue of the price and the value. And not to insist on this, but I think this is a very important message, because systems cannot afford very high prices. We know that innovation is not cheap, it's very expensive. But then when the drugs come to a broader population of patients, the prices should be adjusted to the global burden of health and other economic costs for a country. So I think that the long approval process has something to do with this too. I think that one key aspect is also to have academic research since the very beginning in the process of testing new drugs, and then all the way into the approval. That's because, you know, the biomarker questions or the novel diagnostics questions and select the proper patients for the proper treatment is something that we keep speaking about, but then when we get to the facts, we see that the big industry-sponsored pharmas lack somehow this aspect of better tailoring or selecting the population to give the drug. And that's okay, because they provide lots of data, but I think that the trials coming from the academia are very important in this aspect, because the research questions are very patient-focused, and I think that's a very valuable way to advance the field.